when we did get this question off of Instagram about, needing a release. So if they go through a release, is there a chance that the tongue tie could be regrown? Or I know you talk also about like physical therapists where they would help like move the mouth. Can it reform ever? Is that possible?
Yeah, it is. So once you have the release done, I actually just had my 8-year-olds done. Pediatrician as well as my pediatric dentist blew me off for years. Horrible sleeper, horrible feeder, had low milk supply, had lots of breastfeeding issues with her. Just had hers done at the age of 8. When you have a release done, you have to do exercises because think about when you have a wound on, say, your arm or your any type of tissue on the skin, it wants to grow back together. It wants to heal and go through that healing process. So the same thing with the mouth. If we are not doing exercises a couple of times a day to that area, that wound, and parents are like, well, it's so horrible because I'm actually sticking my finger on the wound where the baby just had the laser treatment done. Well, we want to get in there and just make sure that we're moving that area around. We want it to heal properly to where it doesn't reconnect all of those tissues back together. So it is definitely important to make sure that you're doing the exercises. And that's probably one of the things that is the hardest for the parents. For me, I didn't have it done with my daughter as a baby, I had it older, but literally by that night, she didn't really have any discomfort and she just used her tongue and moved it back and forth on her lip, didn't have any issues with reattachment. With her, our biggest thing, remember, I mean, she's 8 now, so her smile was actually crooked. She doesn't close her mouth fully. She sleeps with her mouth open, poor sleeper. So she had a lot. And like I said, I struggled with milk production with her. She had a poor suck reflux, and it was all related to her lip and her tongue tie as a baby that I was trying to be proactive about, but kept being put aside by medical professionals that weren't trained in it. So again, we'll talk about that in just a second, but you have to kind of go with your gut feeling. If you don't feel like things are going well, definitely reach out to somebody. You're going to find that you're going to have some hesitancy from different providers, whether it be your pediatrician or your dentist saying, no, everything's fine. But also, I kind of go with mom's intuition. I knew that there was something that was wrong. She wasn't feeding like my other 3 kids were feeding. I didn't feel like the breast was empty when she finished feeding. She wasn't transferring the milk. So definitely go with your gut feeling because a lot of times it's just, you don't know what you don't know, and I find that my older doctors typically not as gung ho about it just because it's something, like I said, if there's something more newer that's being talked about that people are learning about. I find my younger doctors are now learning about it in school. They're more aware of it. They have a little bit more knowledge about it. Not to not say that the older doctors don't, but they're the ones that, well, it's been there forever. It's not really causing any issues. So make sure that if you don't feel comfortable with the answer that you got, that you reach out to somebody else for a second opinion because your body, your child. Did that answer your question? I
Yes.
think that was it. I
Yes.
was like,
Yes.
did I go off topic or did I answer your question?
No, that was definitely it. Yeah.